There's a fruit sitting in grocery stores right now that's sending people with kidney problems straight to the emergency room with seizures and paralysis. In fact, researchers found that just one serving can trigger a cascade of toxicity so severe that up to 40% of people with kidney disease who consume it suffer adverse effects. But here's the shocking part. Most people have no idea this innocent-looking fruit is basically poison to their kidneys. What makes this even more terrifying is that this fruit is often marketed as healthy. Health influencers promote it, smoothie bars use it, and kidney patients are consuming it thinking they're doing something good for their bodies, when in reality, they're risking their kidney health. I'm about to reveal which fruits are literally destroying kidneys according to peer-reviewed science, and the mechanisms are more disturbing than you can imagine. But first, let me tell you about Sarah, a 52-year-old woman who thought she was making a healthy choice. Sarah had been managing her chronic kidney disease for 3 years. Her numbers were stable, she was following her diet, and she felt pretty good. Then one day, she decided to try something new at the local juice bar. Within hours, she started experiencing unstoppable hiccups. Not the kind that go away in a few minutes. Hiccups that lasted for hours. Then came the confusion. Her family found her disoriented, unable to speak properly. By the time they got her to the hospital, she was having seizures. What happened to Sarah is happening to kidney patients around the world, and it all comes down to one terrifying truth. Certain fruits contain compounds that healthy kidneys can filter out, but damaged kidneys cannot. When these toxins accumulate, they don't just cause kidney damage, they attack your nervous system. Now, before we dive deeper, I need to mention something really important. If you have any underlying health conditions or take medications, always consult your healthcare provider before making dietary changes. This being said, the information you're about to hear is strictly science-backed, because we fight misinformation by spending countless hours researching peer-reviewed studies to bring you the most accurate information for free. All our references are accessible through the link in the description. So what was in that juice that harmed Sarah so much? Starfruit, also known as carambola. And here's what makes this fruit so dangerous for kidney patients. It contains not one, but 2 different toxins that create what scientists call a double hit of destruction. The first toxin is oxalate, which forms crystals that slice through your kidney tubules like microscopic razor blades. But the second toxin is even worse. It's called caramboxin, a neurotoxin that blocks a crucial brain chemical called GABA. When your kidneys can't clear these toxins, they build up in your blood and cross into your brain, causing the exact symptoms Sarah experienced. Multiple case series published in medical journals have documented this nightmare scenario. Patients start with hiccups. That's actually the first warning sign your brain is being poisoned. Then comes confusion, followed by seizures, and in the worst cases, but very rarely, also coma. The mortality rate for severe starfruit poisoning in kidney patients ranges from 20 to 40%, and those who survive often need immediate dialysis. But here's what's really disturbing. There is no safe dose of starfruit for people with kidney disease. None. Even tiny amounts can trigger this toxic cascade. That's why researchers have labeled it a zero-tolerance fruit for anyone with compromised kidney function. And it's not just fresh starfruit you need to worry about. The toxins concentrate in juices, smoothies, and even dishes that use starfruit as an ingredient. One case report documented a patient who consumed concentrated starfruit juice and developed such severe toxicity that emergency dialysis couldn't save them. But starfruit isn't the only fruit that's dangerous for kidney patients. There's an entire category of fruits that can push you toward dialysis, and they're probably sitting in your kitchen right now. The second category of kidney-destroying fruits are those loaded with potassium. Now, potassium is normally healthy, but when your kidneys are damaged, they can't excrete excess potassium properly. This causes a condition called hyperkalemia, where potassium builds up in your blood to dangerous levels. Here's where it gets scary. Hyperkalemia can stop your heart, literally. High potassium levels disrupt the electrical signals that control your heartbeat, leading to arrhythmias that can be fatal within minutes. A randomized controlled trial in kidney disease patients found that when people consumed a higher potassium diet, their blood potassium levels increased by approximately 0.2 millimoles per liter. That might not sound like much, but in the world of kidney disease, even small increases in potassium can push you into the danger zone. So, which fruits are the worst offenders? The list might shock you, because these are foods most people consider super healthy. Avocados top the list. They're absolutely loaded with potassium. Just one medium avocado contains more potassium than 3 bananas. Then there are bananas themselves, followed by melons like cantaloupe and honeydew, mangoes, oranges and orange juice, kiwis, pomegranates, and papayas. But here's the real kicker. Dried fruits are potassium bombs. When you remove the water from fruits, you're left with concentrated potassium. Dried apricots, dates, raisins, and prunes contain such high levels that even small portions can spike your blood potassium to dangerous levels. One case report documented a patient who loved coconut water, often marketed as a natural sports drink, who developed such severe hyperkalemia that they became completely paralyzed. Their potassium levels were so high that their muscles simply stopped working. This is not a kidney cleanse, despite what social media might tell you. It's a recipe for disaster. The third category of dangerous fruits involves those high in oxalates. And this is where things get particularly tricky because the mechanism is more subtle but equally devastating. Dietary oxalates get absorbed in your gut and travel to your kidneys, where they combine with calcium to form crystals. These calcium oxalate crystals are like microscopic glass shards that can cut and inflame your kidney tubules. Over time, these crystals grow into kidney stones, and the constant inflammation damages healthy kidney tissue. Research has shown that for every 5 milligrams per day increase in urinary oxalate, your kidney stone risk roughly doubles. And diet trials have demonstrated that people eating high oxalate foods while consuming inadequate calcium show dramatic spikes in urinary oxalate levels. The highest oxalate fruits include certain varieties of raspberries and blackberries, as well as dried figs. Now, this doesn't mean you can never eat these foods, but there's a crucial strategy you need to know about. Here's the game-changing hack that can dramatically reduce oxalate absorption. Eat these fruits with calcium-containing foods at the same meal. When you consume 200 to 300 milligrams of calcium alongside oxalate-rich foods, the calcium binds to the oxalate in your gut, preventing absorption. This means pairing those raspberries with Greek yogurt or having that blackberry smoothie made with milk instead of water. Human tracer studies have shown that for every 100 milligrams of dietary oxalate, urinary oxalate increases by about 2.7 milligrams when you're consuming around 1,000 milligrams of calcium daily. But when calcium intake drops too low, oxalate absorption skyrockets. So calcium is very important here. Now, I know what you're thinking. If these fruits are so dangerous, what can kidney patients actually eat? The good news is that there are plenty of kidney-friendly fruit alternatives that can satisfy your cravings without putting you at risk. For those who need to limit potassium, berries are your best friends. Strawberries, blueberries, and cranberries are naturally lower in potassium. Apples, grapes, and pineapple are also excellent choices. These fruits provide antioxidants and fiber without the potassium overload. But here's something crucial that many people don't understand. Not every kidney patient needs to restrict potassium. The latest clinical guidelines emphasize that potassium restriction should only be implemented for patients with persistent hyperkalemia. If your potassium levels are normal, unnecessarily restricting these nutrients could actually harm your health. This is why working with a healthcare provider who understands kidney disease is so important. They can monitor your specific lab values and determine whether you need these restrictions or not. Dietary bans without proper medical guidance can lead to nutritional deficiencies that create new problems. The key takeaway here is that kidney disease is not a one-size-fits-all condition. Your dietary needs depend on your specific lab values, your stage of kidney disease, and your individual risk factors. Some patients need strict potassium limits, others need to watch oxalates, and everyone with kidney disease should completely avoid star fruit. What makes this information so powerful is that it's all backed by rigorous scientific research. These aren't internet myths, but findings from peer-reviewed medical journals, randomized controlled trials, and documented case series from hospitals around the world. The tragedy is that much of this information isn't reaching the people who need it most. Kidney patients are often given generic dietary advice without understanding the specific mechanisms behind these recommendations. They don't realize that something as innocent as a star fruit smoothie could land them in the ICU. But knowledge is power, and now you have the scientific evidence to make informed decisions about your kidney health. You understand why star fruit is absolutely off limits, why potassium-rich fruits can be dangerous for some patients, and how to safely consume higher oxalate fruits using the calcium pairing strategy. Remember, these recommendations aren't about eliminating all fruit from your diet. They're about making smart choices based on your individual kidney function and lab values. Many fruits are not only safe but beneficial for kidney patients when consumed appropriately. The most important thing you can do is work with healthcare providers who understand the nuances of kidney disease nutrition. Get your labs checked regularly, understand your specific numbers, and don't make dramatic dietary changes without medical guidance. If you found this information valuable, make sure to share it with someone whose health you care about. And if you like science-backed content, give this video a like and let us know what's your biggest concern when it comes to kidney health diet. Stay curious and see you in the next one.